All right, if you can't tell based on that, we're going to talk about the heart. Not really anatomical. That's like very hypertrophic. It's not really that big, but I at least wanted it a little bit larger so you can kind of see all of the parts and pieces as we get ready to talk about it. But I thought it'd be fun to kind of pretend it's my heart. So here you go, everybody. That's my heart. So let's go through the story of how blood flows through the heart. It's the best way to learn it is by going through one piece at a time. So first start with where blood returns to the heart. So we're going to go from here and here. So depending on if you're coming back from the top or the bottom. So down here, this is our inferior vena cava. So large cavern-like vein. So then up here, it's a superior. So cavernous-like vein, so very big veins. So if you ever see KVAE, that's plural. So if you're superior and inferior vena cava, that's just talking about both of them together. Now their job is to return blood to this chamber right here, which is going to be our right atrium. Atriums are welcoming center. So you're talking about returning blood to the welcoming center of the heart, the chamber that's collecting. It's nice and smooth. It looks welcoming on the inside. This is like when you walk into a building, that first room with the couches and the fake plants, or maybe they're real. I don't really know. That's going to be the atrium. Then you have a doorway between the atrium and the pump. That doorway, if you're going through the right side, is going to be your tricuspid. And it's a tricuspid valve. You don't want blood to go backwards. So when this big pump right here, which is going to be your right ventricle, when that big pump contracts, it's going to push blood up. So if you see this apex here, the point of the heart, it's going to squeeze and push blood up towards those exits, towards blood vessels that you see at the base. The base is actually at the top of the heart. And when it does that, when it's pushing stuff up, these valves are going to snap closed behind it. So it makes things go out the trunk here or there, out the aorta. So tricuspid valve preventing backflow from the ventricle. We're going to go out towards the pulmonary circuit. So we're going to take a trip to the lungs to become oxygenated, because notice that these superior and inferior vena cava, they're colored blue because you're turning oxygen, poor blood. So we're going to go over to the lungs. So we're going to go out the pulmonary trunk. Now, from the pulmonary trunk, you're going to branch into arteries. They're going to look blue, so we're going to take that pulmonary trunk out the pulmonary arteries, oxygen poor blood, so they're colored blue because they're oxygen poor, but they are arteries because they're going away from the heart. They're going to oxygenate it at the lungs, and they're going to return blood. And so if they're coming back, we call those veins. And so those veins are going to be colored red. And so here's one right here. So this is a pulmonary vein. You have 4 of them. They're going to return blood to the welcoming center for the left side of the heart, so we're going to have the left atrium. And just like what we had on the right side, atrium returns blood there, then you have another doorway. Now over here was the tricuspid, over here is the bicuspid. Trick I use it is try it before you buy it. So you're going to go through the 3 before you go through the 2. And then that gets us into our very muscular left ventricle. So with the left ventricle, you're going to have a thicker myocardium because this one's going to pump blood out the aorta to the rest of the body. So that's this big tube here. Okay, now one thing I did forget to mention is that both of those exits, the aorta and the pulmonary trunk, do have doorways because you have to control, again, for backflow. So when these ventricles are squeezing, they're going to push the doors open, but when they relax, blood will fall back down and those doors will shut. Those are called semilunar valves. The semilunar valve in front of the pulmonary trunk is going to be the pulmonary valve. And then the one in front of the aorta, which is actually kind of missing from my picture, is going to be the aortic valve. So we'll just kind of aortic as being in front of that aorta. So down kind of right here-ish, there's another one behind all of this that you can't really see. All right, so that's a basic blood flow through the heart. If you can make it a story, it'll stick a little bit better. Thanks for watching.